My name is Mohammed Samad, qualified in Dundee 2009. Originally from Glasgow, studied in Dundee Dental Hospital, done a year in VT in Fife. My advice for somebody who wants to buy a practice, first of all, like I say, make sure you know what you're buying, make sure you've went through all the ins and outs of the practice, make sure you know where the practice is located, what the patients are like, what the demography is like. If you've got private patients, is it the NHS patients, what the books are like, are the books quite busy or are they quite sparse, or is it touch and go? You've get the accounts, get the schedules, get everything you can associated with the practice before you make your final decision. You've got to have a wee bit of financial backing. You can't go in there thinking the bank are just going to give you money for nothing. They will want security, they will want you to put security against the value of the business. So whether it's against the actual property you're buying, whether it's against maybe a property you've got, or you may have to ask your parents or your family just to help you with security. You've got to learn to deal with stress. That's the first thing you've got to know. You've got to learn that there's going to be a lot more stress in being an associate. Associate is a case of going in at 9 o'clock, leaving at 5, 6 o'clock, not worrying about anything till the next day. Being a principal, you might have to go in a wee bit earlier every day. You might need to stay late nights, a few nights a week. You might need a weekend here and there just to catch up on paperwork, just to catch up on admin work. Like I say, it's the good with the bad, but you've got to be prepared to give that outlay, especially the first couple of years. And if you do, you see the results. It will take good 4, 5, even up to 6 months from the start, getting everything negotiated, all the prices sorted, all the ins and outs, and all the associate contracts sorted. It will take probably up to 6 months realistically for you to start and finish. There's also lawyer fees that a lot of people forget. They're quite hefty sometimes, especially if there's a lot of back and forth communications. So bear that in mind as well. The other thing to bear in mind is the subsequent tax bills when you do buy, because a lot of people don't realise that, but the tax bills will creep up on you a year later. And some people, what they do is use their tax money and say, alright, I'll buy this but I'll get my money back. That money, you won't probably see that money for a few months, if not 12 to 24 months. So you've got to make sure you've got something for your tax. The biggest issue I would say is probably staff. Me personally, when I went from being an associate, your staff were your friends because you were with them and you were going out and having dinner and nights out and stuff. But becoming a principal, you've got to learn where to draw the line, and that's probably one of the most difficult things to do. There's only so much you delegate to people. Regardless of how many staff you have, practice managers, etc., you've got to make sure you know what happens in the practice. You've got to know what gets ordered, what doesn't get ordered, how the books work, what goes where if something breaks down, who do you call, who don't you call, where the contact numbers are, health board numbers, etc. You've got to know everything as well. Once you know everything about the practice, then you can start delegating stuff. If you just start delegating stuff as soon as you start, then something goes wrong, you don't really know what's going wrong and why it's going wrong. So you get your knowledge, then you can kind of share snippets along to other people. First couple of years are probably the most important time of the practice, to make sure that it's running well, it's functioning well financially, and also as a practice, you've got to make sure the patients still come back, dentists are there, are happy, the staff there that are happy as well. You've got to sit back and just ask yourself that simple question: do I regret doing things and where I am at the moment? I would say definitely no. It's only yes or no. I would say definitely no. I'm happy enough where I am, still going well. Good few years left obviously, but I don't see myself moving. Started VT this year as well. Just another challenge. It's been for 5 years, so I thought I'll try it and see how it goes. Only need to do it for a year, so if I like it, continue doing it. If I don't like it, at least I can say at least I've done it. It's another box ticked off the list. So hopefully we'll see how VT goes, and we'll take it by the chin.